Dr. Katie Sasser, what's up? Thanks for joining me.
Hi. Yeah, happy to be here.
You guys, I'm joined by Dr. Katie Sasser. She's a colleague here at Physio Room. Katie, can you do me a favor, do all the listeners a favor, and just do a more thorough introduction of yourself? I mean, obviously you're our pelvic floor specialist on the team, but tell us more about you.
Okay. Yeah, I'm a physical therapist. I've been a PT for now 10 years, which feels like it happened really quickly. So I graduated from the University of Missouri in 2015, where I was born and raised. And then my family moved out to Colorado in 2023. So I've been mostly in orthopedics my whole career, and then in 2021, I took my first Herman and Wallace pelvic floor course, and then just really took a deep dive from there. So I've been doing pelvic floor therapy since 2021, and still treating general orthopedics, sports medicine, things like that. But yeah, so my family moved here 2023, started at a private practice, insurance based that wasn't a great fit for me, and then joined Physio Room in January of this year. And I love it.
Yeah, we've been happy to have you, and just like me, you're one of those transplants to Colorado. So many people have moved out here, and I like to tell people that Denver is like a Midwest city to me because I feel like I meet as many people that have moved here from the Midwest as from Colorado or from California and Texas or something like that. Those seem to be the trends. Um, Katie, what I'm excited to talk to you about today, and those of you guys that are listening, however you're tuning in to this podcast, really appreciate your time spending it with us. We're going to dive into kind of like a workshop, educational, informational session here today, talking about what the pelvic floor is, what the pelvic floor isn't, and why it's relevant to anyone listening to this, women and men. So, if you're a man listening to this episode and you're thinking, "Oh, this is about pelvic floor rehab. This doesn't apply to me." That's not true. Men can have pelvic floor issues just like women can. The thing is, it's just more common for a female to seek out care for it. It's more well known, even though, as Katie and I might talk about, it's not the norm. And that's unfortunate because it should be the norm that people receive care for pelvic floor related things, whether or not there's a birth or something involved. So, um, Katie, if that's kind of like teeing up the conversation for everybody, you being the expert, where do you think we should start? Where do you like to start this conversation about the pelvic floor?
Well, if I talk to you like you were a client coming in, often my first question is, what do you know about the pelvic floor? And often it is not a whole lot. Or I saw some things on the internet, or I don't know, Cosmo Magazine taught me how to do Kegels a long time ago. So most women, I mostly work with women, are not very familiar with what the pelvic floor is and what it does for our bodies. Um, so often my conversation just starts with that. This is what the pelvic floor is and what it's
Yeah.
supposed to do for you.
Yeah. Well, I would like to get into that. Maybe before we
Yeah.
dive right into that kind of anatomy lesson, um, answer me this. Let's go down the female path first, and then we'll go down the male path. What would lead a woman in the door or to pick up the phone or to search online or something to seek out help from a pelvic floor therapist? What types of things, symptoms, feelings, experiences might she be having? And then we'll go down the male route in a minute. But what types of things might the woman be dealing with that would even lead them to be in this place in the first place?
Yeah, I would say the most common thing I see people for is going to be pelvic pain. So that can be pain in the lower abdominal area, that can be pubic symphysis pain, that can be hip pain, low back pain, SI joint pain, tailbone pain. So really anything in those bony landmarks of the pelvis where you can have pain, I will see people for. Often we talk about stress incontinence or urge incontinence, so ultimately leaking urine or feces, whether that's with impact or running or it just happens out of nowhere.
Yep.
Um, we talk about pelvic pain. Sometimes it's pain with intercourse or pain with penetration of any kind. Um, those are really the big ones that I
Yeah.
see women for, or people for. And then those things change depending on where they are in their lifespan, or maybe they're pregnant and they just want education on what does my pelvic floor do? I want to be set up for success, both in pregnancy and postpartum. And so
Yeah.
sometimes it is more of a, hey, I'm here to coach you through this, and we're doing birth prep.
Yeah.
So those are really the larger areas.
Yeah, so it's kind of like there are four major buckets, right? You mentioned pelvic pain, so like all the things that are in and around the pelvis, having pain within one or more of those areas. Incontinence of different varieties, right? Because there's different subsets of that,
Yep.
and pain with intercourse or insertion of something. And then that fourth bucket being the pregnancy during or postpartum journey, anything that falls into that category. What about on the male side? What types of things might a man be dealing with that he might not even have any clue why he's dealing with these things? What types of symptoms might he be able to seek out assistance from a pelvic floor provider for?
Yeah. It's funny you mentioned that a lot of women seek out this care. I actually think that men, if this area is affected, are way better at seeking out care for
Hmm.
themselves. So if things start to impact the penis, it is like, we got to handle this ASAP.
Yeah, that's a good point.
So the pelvic pain, for sure. Like if you have a pelvis, this applies. Erectile dysfunction can be a pelvic floor issue. Again, pain with intercourse, curves in the penis, whether that is sometimes, there's cases of, hey, my partner's complaining about pain with sex. And we realize, well, actually, it's this partner who needs to maybe adjust what they're doing to make it less painful.
Mm,
Testicular pain, prostate cancer, if you've had your prostate removed, or with aging, your prostate can get inflamed, which can cause a variety of issues. Um, those are probably the big ones for male PT.
yeah. Yeah, I think that makes so much sense. And to your point about like if a man's dealing with issues in this area of his body, he wants to get that addressed, right? I mean, on
Mhm.
both sides of the equation. I mean, if you're dealing with challenges that are related to your pelvic floor function, that's going to be a big hindrance on your life, either in terms of quality and comfort and convenience, potentially, and most likely in terms of confidence or something like that too. Um, and it's really no different than any other area of our body. When something's going on, we want to address it so that we can function and perform to the level that we want to. So,
Right.
with that, let's go down that anatomy education. Let's talk about what the heck is the pelvic floor.
Yeah. Yeah. So my spiel with everybody, if you've been to a workshop of mine, if you've been a client of mine, you hear this a lot. So always my friend here, who I still need to name. I've been going with Elvis, but
Pelvis the pelvis.
I'm told I need a better name. But yes, Elvis the pelvis. So, if we start with bony anatomy, right? This is the middle of our body. You have pubic bone in the front. You have your ilium, so those hip crests on the side. Hip joints land here in the front. And then these connect around to your sacrum. So you have your SI joints, your sacroiliac joints, and then down to your coccyx, your tailbone, with lumbar spine sitting right here.
Hmm.
The bony anatomy of the pelvis. If you look from the top down, so if I'm looking like above my head into someone's pelvis, there's really a bowl of muscles here. If I flip the pelvis this way, so if I'm looking from the legs up towards the pelvis, you have the muscles here. So there's different muscles, there's different layers, they go different directions, but collectively, those muscles sit at the bottom of the pelvis. They have multiple roles in that pelvis. So one, they are muscles, just like the muscles in your shoulder. They keep your shoulder in place and they help you move. So those muscles work for stability. They help stabilize the pelvis, the pelvis, the SI joints, the hips, the low back, and they help you move. Right.
Hmm.
So they work just like muscles in ways that they're not just like muscles. They support our organs like a hammock. And so if this is a female pelvis, you're going to have bladder, going down to urethra, hole number one. You're going to have uterus going down to vagina, hole number two, and then colon on the left, coming down sigmoid colon to the anus for hole number three. For men, right, we have urethra and anus, so we don't have that vaginal opening. There's actually not a ton of difference when it comes down to pelvic floor muscles between men and women. Some just are longer and more external, but ultimately they're the same.
Hmm.
And so The pelvic floor supports those organs. So if you've heard of prolapse, which is just a pelvic position change of those organs, those muscles are keeping the organs inside. So that's where some problems can come up. You get sphincter control. So you have the circular muscles that, hey, my bladder's full. I need to wait to go to the bathroom. You get sphincter control of those
Hmm.
muscles, both at the urethra and at the anus. You also have a sump pump quality of those muscles. So the contraction and relaxation of those muscles helps get fluid. We have tons of lymph nodes, arteries, and veins that go through our pelvis. And so that contraction relaxation helps to pump that fluid out of our bodies. And so there's, some newer diagnoses. They're not that new, but we now have a name for it, like pelvic congestion syndrome and different areas where we're finding that the pelvic floor is impacting the body's ability to get rid of that fluid. And then they play a role in sexual function. And so if my muscles, if I'm white knuckling and I'm not getting good blood flow, you could see how those tight muscles are going to limit blood flow to areas that need blood flow. So erections for men, the clitoris is basically a penis in women, like it needs blood flow for an erection as well. And so the pelvic floor plays a big role into the ability to get blood flow to those sexual organs. So those are the five S's of the pelvic floor and its role, and then anatomically where it is in the body. And then typically from there, we talk about the pelvic floor like an A-frame house. So you walk in, you live on the main floor of the A-frame house. That's where we want your pelvic floor to live. That's the resting tone of your pelvic floor. You need to be able to go to the attic to support those organs. Maybe you're running, you're jumping, you're laughing, you're coughing, you're sneezing, you're lifting something heavy. You need this brace, this control of your pelvic floor. And then, but you can't live in the attic, right? It's hot, there's cobwebs. You need to be able to go back down to the main floor. And then you also need to be able to go to the basement. So the pelvic floor needs to be able to drop, stretch, to have bowel movements, to push out a baby,
Hmm.
things like that. And then we don't want to live there because that can lead to things like prolapse or just pushing down of things that are not supposed to be that low. And
Yeah.
we want to live up in that resting tone. So we really talk about like the role of the pelvic floor and then where it is in that A-frame house are really the pictures that I paint with people to help understand its function. And then you can find different areas in those two stories where things may go wrong.
Yeah. I love that A-frame house analogy because it really helps get the picture in your mind of like
Mhm.
where we are or where we want to be and where we need to be able to transition to by
Right.
contracting and engaging versus relaxing and stretching. I thought some of the pelvis and hip, like bony anatomy, was good too. I find myself having that conversation with clients all the time. Not that it's like that big of a deal, but we want to make sure everybody is educated and understands and knows what we're talking about. Many people refer to the hip
Mm.
the pelvis, or I guess the other way around. They refer to their
Yep.
pelvis as the hip, and they'll
Right.
point to their pelvis when they say, I have hip pain. I say, no, that's not your hip. Your hip is down here, a little lower than what most people think. They're pointing to the pelvis. So it's always like a light bulb goes off when I show somebody the model, and I'm like, this is your hip joint. And when we, a physical therapist, a chiropractor, an orthopedic, whoever, it talks about the hip, they're talking about that acetabular hip joint versus the pelvis. So big distinction there. Let me ask you a question on this. How does the pelvic floor and the muscles that create that bowl that you mentioned play into the most common thing that we treat clients for, low back pain, and the core and creating stability and whatnot? Like, how is the pelvic floor involved in that equation?
Yeah. So SI joint pain too, often I would say people will call that either back pain or tailbone pain,
Yeah.
right? So SI is kind of where those dimples are in your low back. Um, so the pelvic floor I would consider are the top stabilizers of the SI joint.
Hmm.
So if they're not doing their job, the pelvis is really the foundation of the spine. And I have these conversations about the core all the time because you go to a workout class, Pilates, bar, yoga, whatever, and brace your core, tighten your core. But who's ever taught these people how to brace your core? And what does that actually mean? Which is often what I'm looking at. You brace your core. Let me see what's happening in your pelvic floor. And so often a bracing of the core can look like a Valsalva, which is going to push down on the pelvic floor. So you're not getting good stability at the pelvis, or you're
Hmm.
getting some pressure on those organs.
Yeah.
And so when we talk about the core, we want this full canister of stability because your pelvis doesn't function separate from your low back or your lumbar spine and vice versa. These things move together. Um,
And
and so
Katie, what does that mean? What does a Valsalva maneuver mean?
really it's just this holding of your breath, increasing abdominal pressure. Um,
Kind of like a bearing down type of feeling.
yes, but I will say caveat, and this is working in medicine and healthcare. I used to tell you absolutely no Valsalva if you have pelvic floor dysfunction. Absolutely not. And we are finding that that's actually not true.
Mm,
If you can Valsalva and maintain that pelvic floor in the attic, it's okay, right? Like postpartum, you're picking your baby up off the floor. You may need to, I call them dad noises, like or old man noises, like getting out of the chair. That you might do that with heavier loads, and that's okay. But if you are valsalving just to get out of a chair, then there's a strength deficit in the
yeah.
legs, in the core, things like that.
Old man noises. You mean like 35 years old? It's funny. I just had a birthday. I just was at a bachelor party for a longtime friend of mine, and the group of us that were there were basically a bunch of mid-30-year-olds, and we sort of got on that topic about how, life's a little different than back when we were in middle school, high school, college, whenever we all met each other, like the different people that were there. And yeah, most of us don't get up off the ground or off the couch or something without making some sort of noise associated with that these days.
Mhm.
You know what I think would be really cool in this, to as good of an extent as we can on a podcast where many people are listening to this audio, some might be catching the YouTube video. Let's go through how you would instruct someone to do that bracing technique because again, I think this is something that most physical therapists that I know talk about, most fitness coaches and trainers will say these terms,
Yep,
but largely people don't know what the heck they're talking about. And if a
yep,
coach tells a class of 25 people to brace your core, I bet you they're going to do like 25 or 20 different things, right? Like those people are not all going to do the same thing. And the professional that's instructing them isn't even always equipped with like the right words and language to use to elicit the response that they're actually wanting. So let's go through that, like
yep.
talking to the people that are listening. Let's go through bracing your core and how we can kind of cue that to get the stability that we're looking for.
Yeah, so I think again, starting with anatomy, like what is the core? If your pelvic floor is the bottom of the core, you have rectus abdominis in the front, right? Your six-pack abs. You have your transverse abdominis, which is that circular bracing muscle. You have erector spinae in the back that helps stabilize your spine. You have obliques on the side. And then the top of that is your diaphragm. And so we talk about the core like this can of soda, or just this canister of pressure that if you take a deep breath in, your diaphragm goes down and your pelvic floor, your pelvic diaphragm should work in tandem with your diaphragm with your breathing. And
Mhm.
so when we talk about bracing the core, if we have a weakness in one of those areas, that pressure's got to go somewhere. And so really it's about your ability to manage pressure when we talk about core and we talk about bracing. Bracing may look different based on the load that you're asking your body to do. But ultimately, that's where we talk about the A-frame house is where is your pelvic floor when we're bracing? And so often the way that I start this, someone new, is I'm checking vaginally. I'm looking at the pelvic floor. What is it doing? And I say, hey, brace your stomach. And I don't tell them anything.
Yeah,
Brace. And then I'm looking to see what happens.
right.
So when you're just laying there, I'm like, that's not a super effective strategy. I'm looking to see, does the pelvic floor go up to the attic? I don't need it to be super strong. We don't need a Kegel, but we want it to hold that force. I'm definitely checking if we're going to the basement. I'm looking, does transverse abdominis come in? Am I getting this pooch of that six pack, right? We just want that core to kind of come in all together with equal pressure.
Hmm.
And so it gets kind of complex, which is why I think in general we just say brace your core. And so we often try to associate it with the breath. That's probably the easiest way to teach someone to brace their core.
Hmm.
So I will say, hey, take a big 360 breath, let your rib cage totally expand, send that breath down into your belly and into your pelvic floor. And then
Mhm.
as you exhale, let all of that come back up.
Yeah.
If that's hard to dial in, I will say, hey, blow out a candle across the room. So you get a force exhale, and then you feel that brace a little bit more.
Hmm.
And then from there, it's just dialing in like, hey, what did you feel happen at your pelvic floor? Did your abdomen come in? Things like that.
Yeah.
Yeah, and then it gets more complex when we get into lifting. So maybe a brace, you could do a Valsalva and then you lift that load. That may look different with a heavier load.
Sure.
Um, but yeah, ultimately, we're looking to see, are we in the basement with the pelvic floor? Or what's your issue? Are you leaking with lifting? Let's try different breath techniques ultimately to see what makes you feel strongest.
Mhm. Yeah, I love that. And that was a good sort of visual and demonstration for us to walk through in our head because the issue might be different for different people, but it may come back down to bracing. It might be somebody's having incontinence during lifting. It might be that someone has back pain or has hip pain while lifting. It might be whatever the issue is. Speaking of which, that's what I kind of want to ask you when you're working with clients as it relates to the pelvic floor, what do you tend to find are the most common issues? And I don't mean like symptoms they're dealing with. I mean, do you tend to find that it's more common that a person is dealing with pelvic floor weakness, laxity, it's not strong enough, or do you tend to find that it is overactive, it's tense, it's tight, and they don't know how to relax it? Or is it right down the middle?
I would say, at least in my clientele, it's probably right down the middle. Now, my super active CrossFitters, runners, I'm often finding tension, but not always. Sometimes it's the mom of three kids who works a high stressful job and she's not sleeping very well, who's just like a ball of stress and everything is tight.
Yeah.
Um, And so, yeah, I do think it's right down the middle. Sometimes underlying tightness is weakness, and sometimes it's, hey, you're holding a contraction all day. So when your bladder gets full, it says, I'm out. I can't do anymore. So really, you just need to breathe and relax through the day, and then you're going to feel stronger, which feels like a wild dynamic for someone to understand.
Yeah. Yeah, that's interesting because, I've heard, and of course it depends on what your client's population is and where you've worked and who you've worked with. I've heard some providers say that, man, I treat way more on this side of the equation. And I've heard others say, oh, no, everyone that I work with is having to work on relaxing as opposed to strengthening. But it's all of the above. It just depends on the person and their unique situation. Um, Now, having not been somebody who personally has really gone through a course of care for pelvic floor treatment, or that evaluation, I think we can all imagine that if somebody was coming into the clinic, this is a very vulnerable topic and very vulnerable experience to put yourself through in order to get to the other side and improve the symptoms or performance or whatever you're dealing with without maybe going down like every specific detail, but going enough to let us get a good idea of like what does that look like when someone comes in the door to do a pelvic floor evaluation and then maybe that leads to a course of care. Like what can someone expect if they were going to go to seek out pelvic floor care somewhere?
Yeah, we kind of joke in the pelvic PT world like TMI, too much information is not a thing in our space. Of course, a safe provider is not going to force you to share information that you're not ready to share. Um, so often I'll say, hey, we're going to talk about the three P's, pee, poop, and pleasure. You can share with me everything that you'd like, but really it is all relevant, and I'll explain why it's relevant. So I'm asking people about their pee, right? How often are you peeing? What's your fluid intake look like? Poop, I'm pulling out a Bristol stool chart. Are we constipated, diarrhea? Are we somewhere in the middle? Do we have IBS? We end up talking about diet quite a bit. Um, are you sexually active? Are you just tolerating sex? Are you enjoying sex? Are we avoiding sex? Which positions are painful? And it depends why they're there, and some people are going to be more open about that topic and others may be hesitant, and that's okay. Um, but they all matter, right? And sometimes it's pain, right? So that's, a fourth P to throw in there. But really it helps me understand all when we talk about all those functions of the pelvic floor, those five S's in all of those areas, is it doing its job? And if it's not, what's going on? And it just kind of helps us paint that picture.
Rattle through those five S's again for us, the five functions of the pelvic floor.
Yeah. So there's stability, there's support,
Hmm.
sphincter control, sump pump,
Oh, yeah.
and then sexual.
Yeah, I mean, that makes great sense. So someone comes in, you do an extremely thorough intake, really get down to like, hey, what are you dealing with and how can we help you? And then what does that look like as you start to dive into the care side of things?
Yeah, so often from there, I will say, hey, I think the best thing for me to assess what your pelvic floor is doing is to do a vaginal, a rectal exam is pretty rare, but sometimes if they're having tailbone pain and if they're comfortable with it, and that looks like glove, lubricant, one finger. I go in the vaginal canal. Once I get to the top of the vaginal canal, I can feel around on that bone of muscles through your vaginal wall.
Mhm.
I'm looking at those muscles like I would if I was looking in your neck, and I may poke around and find a muscle that is really tender, where you go, oh man, that's my pain. That's the information I'm looking for, but just that's the easiest way for me to access those muscles.
Sure.
I'm looking to see, do they feel strong? Do they feel like they have good blood flow? Do they feel just kind of weak, like they haven't really been worked? Um, and then I'm going to see what your pelvic floor can do. So I may say, hey, can you stop the flow of urine? Okay, can you bear down? And maybe laying down on your back, that doesn't give us a ton of information. Not many people are leaking when they're on their back. Maybe it's when they're standing, maybe it's when they're doing a deadlift. So maybe I'm going to have you stand up and have a sheet wrapped around you like a skirt, and I'm down on the ground and I'm seeing what your pelvic floor is doing in a squat or in a deadlift or in whatever movement is provoking your symptoms. And so we're just really trying to figure out what it's doing. Now, with that, people come in with history, with trauma and different things like that. And so that should, just as a disclaimer to anyone who's like, maybe I want to do pelvic PT, but I have this history of abuse or I just feel really, really nervous about it. It should feel safe the whole
Hmm.
time. So I often my spiel is, hey, you were in control this whole time. Just because
Yeah.
you gave me consent when we started doesn't mean that I have consent this whole time. If at any point you want me to stop, I will be done and I will walk out of the room and you can get dressed. Like we don't have to do this if you're not comfortable with it.
Yeah.
And so I think it is super vulnerable. And if you're having pain with sex, like that often, not often, very commonly can come with a history of emotional or sexual abuse. And so we
Sure.
we do dive into those things sometimes. So yeah, if you go to pelvic floor therapy and it doesn't feel like a safe space, you should find a new pelvic PT. But I would
Yeah.
argue most of us that got into pelvic PT really, really care about creating that space.
Yeah, definitely. And I mean, and I like how you use the analogy of working on the neck and assessing and analyzing muscles and tone and things. Like it really is the same in terms of it's another area with bones and muscles and nerves and whatnot, just like anywhere else. It's just different because of where it's located on the body and how we have to access those muscles and whatnot. And I think one thing I'd maybe like you to sort of answer or just give us an idea of what this would look like, whether trauma or not is involved in the equation. Like, say somebody comes in, but for whatever reason, they're really not ready to go down the route of having an internal examination. Or maybe the facility doesn't offer that. Maybe they have people that, they work with people for pelvic floor related things, but they do external based treatment. What might that look like? What types of things are you doing in pelvic floor sessions that don't have to do with internal work?
Well, some of the pelvic floor muscles are double as hip stabilizers, right? So your obturator internus is
Hmm.
probably my favorite pelvic floor muscle. We can access those things like feeling through your glute. If you are like, hey, I don't want to be touched, that's fine. I will often put someone on like a big Swiss ball and say, hey, can you contract your pelvic floor? Like, can you get to the attic? Can you feel that? And see if they can get in tune with their body and just report back to me what they're feeling.
Hmm.
Sometimes that's enough. Because women, maybe they're on their period and they just really don't want anything internal, and that's okay. Um, it doesn't bother me, but I want people to be comfortable. So And sometimes it just looks like, hey, you're not bracing your core correctly.
Yeah.
Um, and so that's where a lot of pelvic PTs, I think, will just maybe that don't do internal work. They're teaching you to brace your core and your pelvic floor. Um, Often, if pain is a piece of the puzzle, an internal exam is really, really helpful.
Hmm.
But I don't tell anybody, hey, I can't work with you if you don't let me do this.
Sure. Yeah, exactly. That's probably not going to help people feel comfortable, right? So, yeah, I think that's great. And I mean, like you said, many of those muscles double as hip stabilizers,
Yeah.
and you don't access them necessarily from the inside, or you don't have to. Um, well, let's change gears just a little bit because I thought that was a good example to give someone the idea of like, okay, what does it look like to go in for a pelvic floor session, like the first one, like what are you even expecting? Because when people don't know what to expect, it's hard for them to feel comfortable. So I thought that was awesome. So thank you for
Yeah.
doing that.
Yeah.
I have a couple like random, I don't know if they're random, but like questions that I wrote down that I think fall into this kind of realm. And I guess the first two here are related to incontinence, right? And I've seen different numbers out there for this first question. So like whether it's male or female, is there a certain amount of time, number of seconds that we should be peeing for when we go to use the bathroom, right? Like someone goes to use the bathroom and they have like a very short urination time versus they have a really long one. Like to know that we are functioning properly, our bladder's functioning properly, our pelvic floor muscles are functioning properly, we're not dealing with some type of incontinence. If we go to use the bathroom, how long should we be urinating for?
Um, what I always tell people is 14 Mississippi. So once
Ooh.
your stream starts, not that beginning trickle or whatever's going on at the beginning and at the end, at a normal stream, 14 Mississippi. So one Mississippi, two Mississippi. Um, right. That's a super ballpark. But
Yeah,
it helps understand, are you dealing with urgency where you are going all the time and it's like 3 or 4 Mississippi, or are you my teachers and my nurses who don't
yeah,
go to the bathroom all day? And you're like, holy smokes, your bladder is holding a lot of volume.
yeah.
So, yeah, it makes public restrooms really fun when you are aware of this knowledge. 14 Mississippi.
Yeah, and it's funny you mentioned like the teachers and nurses and stuff. I think sometimes we feel that way probably as
Yep.
physical therapists. Like if I wrap up a session just a couple minutes later with somebody than I was expecting to, and now I'm like, well, shoot, I need to jump right into this session with the next person. We're just going to hold it for a little while, and that definitely happened. So I think that was good. And now what maybe goes into that? Not that this necessarily, well, I guess it could. Not that this necessarily impacts the amount of time that you're actually spending going to the bathroom, but it definitely could impact your time in the bathroom. What's your stance on? And if you're listening to this and you're about to hear me ask this question, you probably do this. What's your stance on when people take their cell phone into the bathroom and they are peeing or they're pooping and they are on their phone and they're on the toilet for a lot longer than what they're actually going to the bathroom? How does that play into the function of our pelvic floor? Or like, what would you say to that whole topic in question?
It's funny because I've seen this post lately that's like, I birthed a baby faster than my husband went poop. Like, it's like this well-known thing that men just take their phone into the bathroom for a poop and they're in there forever. Um, I tend to not, if you take your phone in the bathroom, one, we could just talk about like, it's kind of gross. And the germs that are on your phone and that, but that's not what we're really asking here. If you're a person who's not feeling like you're fully emptying your bladder or you're having constipation, right? Like, are you fully breathing and relaxing and letting your pelvic floor go to the basement
Mhm.
on the toilet? And when I say basement, I don't mean like pushing it out. I mean, like, is it in a fully relaxed state?
Yeah.
Or are we like getting this dopamine and we're scroll, 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 and so we're not fully letting go
Hmm.
in the bathroom.
Yeah.
Now, the other piece is if you're just sitting on the toilet and you've done your business, but you're sitting there and just letting things kind of hang out, we don't really love that either. And so if you have constipation and you're just kind of sitting there, sitting there, sitting there, I'm often going to say you got about 5 minutes and then you need to get up and walk around. Like, I don't want you hanging out on the toilet all day trying to get this poop out. Like, movement is one of the better things that you can do. Yeah.
Yeah. Yeah, I love that. And I think we're probably all guilty of that in some capacity, right? Like spending longer time in there. I see I saw some video too of like or a picture or post or something that was about men staying in the bathroom too long, where it's like, oh, a man hears, or this is like a dad joke, right? Like a man hears the baby start crying, and then all of a sudden now he has to go to the bathroom. It's like my time to escape and let mom handle it. Um,
Oh,
but
yeah.
but basically, what you're saying is, especially if we're dealing with lack of emptying, lack of ability to efficiently go to the bathroom, and you're that person who is spending time in there on your phone, that could be impacting your pelvic floor function and your ability to just do the business that you need to do while you're in there.
Yeah. Well, and I think of like my toddler moms too, where you got a kid like knocking on the door, coming in, like they just don't get to fully relax on the toilet. Or you're trying to rush, right? You're in between clients, so you're just like,
Mhm.
gotta go, gotta go.
Yeah.
And so really, yeah, it is about like often my cue is you're gonna take a couple breaths when you get on the toilet and just focus on your business.
Yeah.
Yeah.
Yeah, and I think, kind of along with that, the stress, whether it's a mom or whatnot, I think that plays such a big role. I know I think I've heard you talk about this. I've definitely heard other people talk about this kind of linkage between stress, neck and jaw tension, pelvic floor, and how those things are kind of all interrelated. And whether it relates to social media or the workplace or whatever, we're all way too darn stressed out, right? Like probably everybody listening to this feels more stress in their life than what they would like to. So when you're working with a client who's dealing with that and you think stress and holding of tension is a big piece of what they're dealing with, and if we can just get a handle on that, we may be able to get a handle on the symptoms they're dealing with. What types of things do you do to try to help them manage some of that stress, mitigate some of it through their body, and then deal with it in their life so that it doesn't just continue to come back up over and over and over again?
Yeah. I think some people may come in and say, once we close on this house, then I can dial this in. And often I will remind people like life is stressful. So really we have to work on how we manage it in our bodies because if it's not that, it's going to be something else, right? And so stress is a part of life. Now, do we have moments that are incredibly stressful and we're holding it all in our bodies and things like that? Sure, right? Having a newborn is very stressful, but right, we have to find ways to cope and connect with our body. So often my first visit, like we're just focusing on breath and your ability to go to the attic and go to the basement. And my homework is I need you to check in with yourself throughout the day. I have many people, they find out, oh my gosh, on every Zoom call, I am just like tight. Why am I holding everything? Or the
Mm,
joke is like, why are you clenching your butt? You know,
yeah,
you're not on a motorcycle, like going on a road in the mountains. Like we don't need to be clenching. And we do that, women are taught to brace their core and hold their tummy in, or maybe you are postpartum or perimenopausal and you have this tummy fat that you don't like. So you're just holding, holding, holding all the time. And I'm like, hey, you got to let that stuff hang out. Just get some drawstring pants, get some loose shirts, like just really checking in. Like, are you in the attic when you don't need to be in the attic?
hmm
Um, and often, that comes with mindfulness, that comes with, hey, your teeth are not supposed to be touching when you're at rest.
right.
Let cheek to cheek, like let's try to calm some of those things down. And if we are especially holding in our pelvic floor and in our abdomen, like imagine what that's doing to your digestion. There's rest and digest. And then there's like clenching, hey, I'm in a cave with a tiger. Like we don't have time to poop. Like we're
Yeah.
trying to live. And so how that clenching piece can contribute to those issues. Um, so yeah, and sometimes it is, hey, I really think you should go talk to someone. Like, I really think you should see a therapist. And often I lead that with like, hey, I've been seeing my therapist, Sarah, every other Monday for 5 years.
Hmm.
Like, if you go to the gym, like, why wouldn't you see a therapist? Like, it's mental health.
Yeah.
So trying to normalize that piece of it too. But yeah, life's freaking hard, you know? I try to validate that as well. How can we check in with our bodies
Mhm.
more
Yeah,
often?
totally. I mean, life is hard. And I feel like the longer that you have gone through your lives, you learn that you just get better at handling more and more stressful things because, I was in this men's group conversation recently, and a very new dad was sharing his experience about how stressful and hard he and his partner have been, like the challenge they've been going through with this like 10-week-old. And then, he's kind of feeling like, man, I don't know how we're going to get through this. And I think if we were to put ourselves in his shoes, we felt the exact same way. But there were plenty of us in the room that have one or multiple kids who have already gone through that, that are also in the back of our head, sort of thinking like, man, that's nothing. Like, you're gonna go through way more challenging things down the road, especially if you plan to have another kid, or you go through, many people will go through marital problems and they have kids or like whatever. And but if you haven't dealt with any of those things yet, you don't know what that feels like, and you're just stuck in the place that you're at now, trying to handle it. So life is stressful, and like you said about the when I close on the house, when I get this job promotion, whatever, there's always going to be something. So there's never like a perfect time to deal with any of these things or handle these things. It's just the place that you're in, and that's where you start and start to deal with it. So because it's always going to be something.
Hmm. Yeah. Oh, for sure. And I think if we can like love ourselves in that way, right? Like usually that first appointment, that's why I say, hey, I just want you to check in with yourself. Like I'm not asking you to set aside 30 minutes. Like I'm not asking you to create this new habit
Yeah.
yet. But right now, I just need you to like find this part of your body and see what's
Mhm.
going on. And maybe that just looks like adding a meditation practice, but we are really good at just like locking in and just like surviving each day, and just being so disconnected from our bodies. And
Yeah.
so, yeah, it's a huge piece. It's often harder work than if they're like, "Can you just give me some squats?" I'm like, "No." I need you like hourly or every other hour to just breathe into your butt. Thank you.
Thank you. No, Katie, I think this has been great. I know, we've each got things coming up here at the top of the hour, and I want to ask you, did we forget anything in this conversation? Did we gloss over something that's really important, or did I not ask you a question that would have been really good to ask? Anything come to mind?
Oh boy. I could talk about this topic forever.
Yeah.
So I would say, I don't think I know anybody who would say, hey, we're really good at treating women's health in this country. I don't think anybody would say that.
Yeah.
I would say two really large groups of women that don't get great health is a postpartum mom. So
Mhm.
you have all these checkups in pregnancy, and then you go in at 6 weeks and they're like, cool, you can go have sex and you can exercise. Let us know if you get pregnant again. And you're like, wait a minute. Like what just happened? Like, so there's a huge gap in that phase of life. I think that typically leads to inactivity or less activity. And then often women are having babies in their 30s, right? So maybe by the time those kids get older, if you've been inactive for that many years, you might be headed into perimenopause and
Yeah.
menopause. So we also have this hormonal shift that happens then where bone health is going to get worse. You know, if estrogen is going in the tanks and you're feeling moody and all over the place, that like started when you had kids, that you just started to get weaker because you didn't really have the guidance or the time that you perceived to stay strong.
Mhm.
So really like one of my larger missions and groups of women that I really care about is this postpartum mom
Yeah.
and this perimenopausal, postmenopausal woman of being being a mom is hard. Going through menopause is really hard. Being weak and in those phases of life is even harder.
Mhm.
Um, and so teaching women to move their bodies, or maybe just education on, hey, your estrogen is really low. Like sex is going to be painful. Like here's some ways to make sex less painful. Or you're not crazy. Your hormones are looking like our stock market in perimenopause. Here's some good people to go see. Maybe you need some hormone replacement therapy. Maybe, we really need to focus on resistance exercise and strengthening more than just walks or swimming. Like
Yeah.
those areas where I think we're seeing shifts. It's not happening very fast,
Yeah.
but I do think like a pelvic PT that can address those larger things in
Yeah.
those areas of life is super important. And you can tell I get pretty worked up about it. So,
Well, and I think we just, and you and I were kind of talking about this a little bit before, so a few weeks ago. I think we've got another conversation topic there that we need to unpack on a different episode because I think you're totally right. Obviously, I'm not the one personally going through it, but having that sort of passenger seat to going through the pregnancy and postpartum journey, going to the vast majority of the appointments with Erin, you're totally right. Like all these appointments, especially postpartum, but even during the pregnancy, all these appointments are to check on the baby, right? And the tiny little bit of the appointments that gets focused on the mom is kind of like a last second question right before the provider walks out of the door, like, and how are you doing? Good. Okay, cool. And some resources are given and things, but largely the mom is on the back burner, so to speak, compared to the infant or the soon to be born baby in these appointments.
yep.
And it shouldn't be that way because if mom's not doing okay, well, then the baby can't do okay, right? Whether that baby is unborn or it is born, mom has to be doing okay herself and dad too, so that the baby gets the most positive experience possible, right? Like it's, take care of it's that whole analogy of like put on your own mask first in the airplane and whatnot, right?
Mhm.
It's true in pregnancy and postpartum too. And our um I feel like the hormone replacement and the perimenopause and stuff and just the aging conversation, aging and longevity conversation has just really finally came to light in the last couple of years. And I think you're right, there's a shift happening, but it's not fast. And I would not say that it is feels available to the masses just yet. I think there are many people that I think are participating in hormone replacement and whatnot. But I think that's still just like such a subset of the population that we happen to be exposed to because of what we do and who we work with. But it's not the norm out there, and it's not part of the traditional medical model at all.
Yeah.
So, yeah, we've got another conversation we'll have to have. If the conversation we have had so far on this episode, Katie, brings up some questions for people, or they want to be able to reach out, find you, find us, what's going to be the best way for them to do that? How can they get in touch with you or get in touch with us to ask some of these questions?
I mean, I'm totally fine with a personal email too. Most people don't want to call our front desk and say, hey, can I talk to Dr. Katie about peeing my pants? So it's Katie at physioroomco.com. I'm on Instagram. It's mostly just my family, but you're welcome to join along and slide in the DMs. So it's dr.katiesasser.dpt.
Mhm.
Um, and you can find me on there too. You just get to see a lot of pictures of my baby Quinn because I'm obsessed. So
Baby Quinn's a cutie. And one more thing before we sign off, Katie, I just thought of this. Say somebody is listening to this and they are not near us, right? They don't live in Colorado. They don't live near Denver or Colorado Springs or whatever where we're located. What might that look like if somebody is interested in having a virtual kind of conversation as it relates to pelvic health? What does that look like?
yeah, I mean, I'm totally happy to go down that road with people. Again, like we talked about, you don't have to have an internal exam. Sometimes people just want like an hour of someone to listen to them and say, no, that's not the normal part of just being a woman or having a baby or being in menopause. Like, yes, there's things you can do. And I'm not afraid to say, hey, you probably need to go find somebody in person.
Yep.
And so there are search engines just to find a pelvic PT in your area. You can just Google that. There's two different search engines that work. And then often I try to find those people on social media or
Yeah.
try to find more information about them to see if it's a good fit. If people wanted to come in here, like I've done phone calls just to see if we're a good fit before they
Yep.
come in, and I'm happy to do that because it is vulnerable care. Um, and if you clash with that therapist, that could be more traumatic for you. So
Totally.
yeah, I think just taking that step of finding someone and just getting it scheduled is a really good act of self-care.
Yeah.
Um, and so I would love to see women doing that.
Yeah. Well, you guys, men, women, whoever's listening to this, I think, it's the middle of 2025 as we're recording this. There's so much that we can do, even if we're not in person. And just like Katie said, whether that's on the pelvic floor side of things, whether that's on the orthopedic side of things, if you're not local to us and you've got an issue that you're dealing with, we would love to be a resource for you guys. And we will help you to the best extent we can virtually. And if we think, and like our professional judgment is that, hey, you need to check in with somebody in person, we have a large network that we're connected to, and we connect many people with other physical therapy or similar types of offices, maybe a performance chiropractic office or something, even physicians' offices outside of state because like we talked about at the beginning, Denver and Colorado is like a big transplant place. Like we know many people that live here, but they travel or they have family somewhere else because they moved here. So we are very often giving recommendations to other places and other people across the country. So if if you don't want to just hop on Google and take the first type of place you find because you don't really know and have like a referral or recommendation to them, reach out to us. We'd be happy to see who we know in your area or in your family's area and get you guys connected so that you get the best care you need, even if you're not here. So, Katie, I really appreciate your time hopping on this conversation. I thought this was great, and I think everyone that tuned in to listen is one going to be way more educated on what the heck the pelvic floor is, what it does, and why it's important. But two, I think just maybe open some of our minds to like, man, what could seeking out pelvic floor care do for me or someone I know? Or is that an area that I haven't even been thinking about? And then just like a light bulb kind of went off in their head. So I really appreciate your time hopping on this conversation with me.
Yeah, it was fun. And pelvic PTs, we are like a cult. So I'm happy to also find a pelvic PT for you or message them myself just to
Yeah. Love it. Well, we'll put all of Katie's information there in the show notes. So if you guys have questions, you know how to get a hold of her. You know how to get a hold of me. And again, Dr. Andrew Fix with the code. If you've listened to this podcast before, you've heard me say this. And if it's your first episode, thanks again for joining us. This would be an awesome time for you to scroll down to the review section of whatever podcast platform you're on and drop a 5-star review on there. The only way we can get this show out to more and more people and spread this information is by you sharing it with someone you know. So if there's someone that you think could benefit from listening to this episode, please send it to them. When you make a great recommendation to someone, that's going to come back to you tenfold. So thanks again for all of your time tuning into this episode of The Code, and we'll catch you next time. See you later.